Hello, everyone. Welcome to the podcast Mindful Motherhood, where we break down complex health topics into easy to understand conversations. I am Anna Escary, and today we are diving into the topic that affects millions of expecting mothers, how stress during pregnancy can lead to gestational diabetes and impact both the mother's and the baby's mental health genes. This is something most people don't talk about, but it's incredibly important. How does the stress affect pregnancy? Why do some women develop gestational diabetes while others don't? Can stress actually change a baby's mental health before the birth? And most importantly, what can we do about it? And for this, we have an amazing expert, Tima Avid, who is Associate Professor at the Department of Physiology at Jenison Medical College and Director of Admissions at GSM as well. All right, so we will start with the first segment. What is gestational diabetes and why should you care?
Gestational diabetes is common to an extent that around 14%, its prevalence is around 14% worldwide. And it is said that 1 in every 10 women suffers from gestational diabetes. And no, not all the women should be worried about it because there are risk factors leading to gestational diabetes. Women who have positive family history, women who are suffering from polycystic ovary disease, women who had GDM in the previous pregnancy or the family history of diabetes mellitus, or women who have metabolic syndrome or any metabolic disorder are more at risk of developing gestational diabetes.
Oh, so is gestational diabetes common? Should all pregnant women be worried?
It's a common misconception that maybe during pregnancy that a woman becomes insulin resistant, or maybe there is lack of insulin, or the insulin is not working, probably not working the way it should be working. But what happens actually is that during pregnancy there are a large amount of hormones which are crossing the placenta and entering the maternal circulation. So those hormones are actually making insulin less sensitive. This less sensitivity of the insulin actually leads to gestational diabetes, along with many other factors that includes the epigenetic modifications, lifestyle risk factors, maternal stress, and other factors. Collectively, they all lead to gestational diabetes.
Okay, so does that mean all stressed pregnant women will develop diabetes?
Necessarily that all the women who are at stress might develop gestational diabetes. It varies from a mother to another mother, varies from a woman to other women. So some of the women, they have lack of support system. They are emotionally more vulnerable of developing gestational diabetes. And there are many women who have strong genetic factors which make them prone to develop. There are several genes which are associated in the development of gestational diabetes, and those genetic factors or modifications, epigenetic modifications or mutations at the genetic level make them vulnerable to develop GDM along with the other factors. So not all women, yes, some women are more predisposed.
Moving forward, we're going to our next segment, which is how does stress cause gestational diabetes? I thought stress just affects emotion. How does it affect blood sugar?
Stress, if you look at the stress physiology, if a woman is at stress, this is all connected with the hypothalamic pituitary axis. From the hypothalamus, we have corticotropin releasing hormone, which acts on the pituitary gland and causes the release of ACTH, which is adrenocortical hormone. And then moreover, from the adrenal glands, then there is release of cortisol. So this cortisol is actually, which is released from the maternal adrenal glands. They cross the placenta, and this is lipophilic and it can cross placenta, and when it crosses placenta it causes a baby to be stressed too. So if you talk about how it affects the maternal mental health, it starts with the development of cognitive development to the development of soft skills, motor skills. Not only this, there are many newborns who are born with many problems even at the time of birth. So that starts with the cognitive development. Later in the life, they have learning disabilities, they have a lot of problems, emotional disabilities, they are very aggressive, they develop anxiety, they develop depression in the later life. So yes, everything starts from the pregnancy. It is mother who is passing the stress on to the babies, and the newborn who comes to this world from day one develops such symptoms.
Are these effects permanent? Can they be reversed?
You see, yes, the good news is that these changes are reversible, and we can do a lot to make sure that the moms stay healthy through pregnancy and beyond. And epigenetic changes these are the changes which are not passed on to the genetic level. These are the changes or modifications which have something to do with the environment. So yes, if mother is getting the nurturing environment, a very strong support system, emotional support, all kinds of support, a mother can cope with the stress. And yes, if these changes are intervened in between, if even before, if they are not passed, yes, we can help the pregnant women, and these changes are reversed.
And what would you suggest them to, like recommend them to take care of just to make sure that this doesn't happen, or if it happened, that it may reverse, like any practice or any prevention that you would suggest?
What I feel is that the mothers shouldn't be left alone. It's pregnancy or suffering from GDM or suffering from maternal stress or suffering from any mental condition during pregnancy is not a stigma. It's something. It's thought provoking for all of us. What we should do is we should ensure that the mothers are active. They modify their lifestyles. They have very strong support mechanism. We should encourage them to sleep well, to do exercise, to meditate. They should have the family, the close relationships. She should get the support of all close relatives. If there is a need, she should also seek professional help from the professional, from doctors to the psychiatrists to the psychologists and so on. So yes, we can help mothers. Together, we can do it.
That is a great news. Right. All right, we have our last segment, which is the bigger picture. What research is being done? Are researchers studying this? Is there hope for better treatments in future?
Okay, this is very interesting. Absolutely, the scientists not only at Malid University of Science and Technology, scientists at Gestational Medical University, and scientists all over the world. They are also working now at the genetic level. They're looking for genes which might be responsible. They have identified more than 21 genes responsible for causing stress during pregnancy in GDM women. So a lot of studies are done in Pakistan as well. And we are looking for mutations at the genetic level. We are looking for single nucleotide polymorphisms. And we are looking for epigenetic modifications which are leading to those stressful conditions during pregnancy. So this is a good news that now we are working at the grassroots level to see at the genetic level and to make sure that the women who has not even suffered yet, how, if she has any susceptibility for developing diabetes mellitus or for developing stress, she should be screened and should be given treatment before time.
Ma'am, what do you think that what is the best way? Ma'am, what do you think that what is the best way to actually epigenetically modify these things? What is backed by the research? Because there are so many, even in technology, there is coming like there is epigen machine that modifies your at the epigenetic level, and there's CRISPR-Cas9 that's for the genes. So do you think that is there a way that we can, or is there a kind of, parameters that we really need to follow, which can be naturally done, and then if we need to go to the, other options like the advanced?
Yeah. See, epigenetic modifications are those modifications, those that are not expressed as yet. And they are at the environmental level. They are at the level where we can work at that level to modify those changes. See, once the things are expressed in the genes or once the genetic mutations are done, it is very difficult to go back and to reverse the changes. So what we need to do is we need to minimize the stressful factors, whatever factors are present in our environment. That might include factors which might have some relationship with the environment itself, with the lifestyle, with the dietary things, or maybe with the emotional or social support mechanisms. So these are the factors which are actually the epigenetic factors which are working at the environmental level, and their interaction at the environmental level is actually leading to the genetic mutations and is further leading to stress. So yes, epigenetic modifications, if we try our best and if we work at that level, we can do a lot.
Yeah. So you know that our society is like most of the mothers are naturally in distress. They don't have a support system. They don't have guides or anything. Should there be any campaign that at the public health level or psychologists to?
Yes, you see, what we can do is together we all like see a mother can help another mother, one woman can help another woman. So we should teach in our societies, we should raise awareness among women that pregnancy is a very beautiful, empowering journey. Not even only pregnancy, even the motherhood. So what we can all do is we can help mothers develop their support mechanisms, uh, because when a woman is working on her career life, at the same time she has to raise her children, she has her parents are ill, maybe her husband needs more time, her in-laws are not supportive. So you need to a mother cannot give her 100% everywhere. So what she can do is that she should develop support mechanisms. She should develop such mechanism that can aid and help her in her professional life and her at her home with such supports that can help her in her motherhood as well. See, if a mother is at office, maybe she can have somebody as a help at home. She can monitor through cameras or through other new modified technologies at home what is happening, so it's only about connecting with the support systems at home that are available in the form of her parents, her relatives, in the form of the supports we have as our house helps. So in this way she can cope. She can, it is only that she should be encouraged that she can do it. See, हम हर जगह सब कुछ, we cannot do everything.
So I think that again, I ask my students to actually start a campaign that you have to aware the expecting mothers how you have to manage the stress and all the things that you have actually shared. That can definitely bring a lot of difference.
She undergoes stress when she feels an imbalance in between what is expected of her and what she can do. So, because see, pregnancy is not a disease. It's only that she should be guided, she should be counseled, she can do all. She cannot be everywhere, she cannot give her 100% everywhere. She has to make sure that people around her also are also doing their roles, they're also performing their duties and responsibilities. Unluckily, mothers are of such nature that they take everything on their shoulders. They rely less upon others. They make sure that they give their 100% everywhere, whether it is at their office, at home, or with the relationships. So she needs to understand that if she develops strong support mechanisms, support systems, she can cope then.
Yeah, I think it's a women thing I've seen, not just a mother thing, that they want
It's a
to
women
be, and they just want to be, that super woman, that trophy wife, that trophy bahu and everything. So it's
Actually, we do not work on supportive communities and societies. We are just expecting from others that they are some kinds of machines or some kind of I don't know. We consider them as monsters who can be 100% everywhere. So we have to raise awareness to at the society level that everybody has to perform their own duty. Then she can live her life also in peace.
actually done with the session, but I really want to know if there is anything that you think is important that should be, come into the knowledge of the mothers, expecting mothers, and the mothers who are already having a baby, or if there is any tip, any, concluding remarks or things that you would like to mention. And we would actually like to listen to you and understand that, what most we can do about it.
Yes, stress is a big factor, and pregnant women can be counseled for mindful exercises, for yoga, for meditation. She can be guided that she should stay active. She should adopt exercises. She should modify her lifestyle. Moreover, she should meditate. She should sleep well, and a lot of support can also help a mother to cover from this stigma or from this condition.
Thank you so much, Dr. Fatma, for educating us, helping us understand the mindful motherhood and a very important question and answering very important questions. Stage of mindful motherhood. If you found this discussion helpful, please share it with the expecting mother, a friend, or anyone who should know this. And remember, a healthy mind leads to a healthy pregnancy. So take care of yourself, stay informed, and we'll see you next time.